Hi, I'm Charlie Sauer, president of the Market Institute Foundation and editor of U.S. Policy. Today we're talking about a new paper out from Cato called Drug Reformation, In Government's Power to Require Prescriptions. And our guest, well, here's a little clue.
My name is Rex, and if you study with my 8-week program, you will learn a system of self-defense that I developed over 2 seasons of fighting in the octagon. It's called Rex Kwando!
All right, I am here today with Michael Cannon. He's the director of healthcare policy at the Cato Institute, and he's somebody that if you are following healthcare policy, you need to follow his writing and his work. But he recently published a paper, and it's why I have him here today. It's an issue that I've been paying attention to for a long time, the pharmaceutical regulation and what goes on in the pharmaceutical space. We all know that there's high drug prices in the U.S., but we don't necessarily understand the reasons behind them. And the paper deals with one of those big reasons, and it's the government. The government is the problem. And so, Michael, thanks for coming on today.
Thanks for having me, Charlie.
Can you tell me a little bit about, well, why don't you start off with the idea of this paper and what you started on when, what hit you as an idea to start this paper?
So the paper that you're talking about is a paper called Drug Reformation. It's about government imposing prescription requirements that mean that if you want to purchase oral contraception, if you want to purchase insulin, if you want to purchase any of hundreds of thousands of drugs, you have to go to a doctor to get a permission slip that we call a prescription if you want to go and buy that drug. Prescription requirements in the United States come from the government. There was a time when it used to be that if you had a willing buyer and a willing seller, then the manufacturer of that drug could sell it to anyone they wanted without a prescription. They'd face liability if they sold people unusually dangerous drugs and that harmed people, and that threat of liability did require enforced manufacturers to sell some drugs only pursuant to a prescription from a physician. But for the most part, you could go buy any drug you wanted without needing a permission slip from a government-appointed gatekeeper. The way this paper came about it's not just my paper. I co-wrote it with my colleague, Dr. Jeffrey Singer, who's a general surgeon in Phoenix, Arizona, and a senior fellow at the Cato Institute. The way this came about was Jeff Singer looked at this issue. He was thinking about it in his practice. He has people coming to him all the time asking him for permission to take drugs that really they have a right to purchase if there's a willing seller out there willing to sell it to them. In fact, there are all sorts of ridiculous episodes he's talked about from his practice where he is prescribing drugs for people that are drugs that are outside his specialty, but he's perfectly comfortable prescribing them for these people because A, he thinks he has a right, these people have a right to use these drugs if they want, but B, his patients are more knowledgeable about those drugs than he is as a general surgeon, and he just wants to spare them the hassle of having to go to another specialist, which can take hours and hours and cost hundreds of dollars just to get this government required permission slip.
I actually find that a lot, and that's something that I've focused on when I'm working on policy. It's that where the rubber meets the road, when you're talking to doctors, they understand where the government is coming into the exam room and getting in the way. So I think that that's really an amazing resource, and it definitely led to a great paper. You started hitting on this for a second ago, but can you talk, maybe we can start with kind of the history of the FDA or drug regulation. I know that the paper does kind of a slow walk through the regulation, but can you hit a couple of the high points of where regulations change?
An exhaustive review, you might say. So what happened was in this country before about 1938, you could buy just about any drug you wanted directly from a manufacturer or pharmacist. There were no government-imposed prescription requirements except for some narcotics, but generally you could buy any drug you wanted. Then in 1937, there was the elixir sulfanilamide tragedy, which led to the deaths of 105 Americans, including 34 children, and led Congress to pass the Food, Drug, and Cosmetic Act. Now, most health policy wonks know that that law imposed the FDA's safety standard, where you have to show the government that your drug is safe for its intended use in order to take that drug to market. But what it also did is it imposed a lot of labeling requirements and expensive labeling requirements and exemptions from those requirements that the FDA then turned into a de facto power to require prescriptions for certain drugs. Congress and the people who wrote this law completely disavowed any such intent. They said, we're not trying to infringe on the right to self-medicate. We are trying to just make that safer. We're not going to take away your right to self-medicate, but that's exactly what the FDA did. The sulfanilamide tragedy provides no justification for that, by the way, because 95% of the people who died from elixir sulfanilamide got it from a doctor, took it under a doctor's direction. So there's no warrant for requiring prescriptions. Fast forward about 13 years, the Congress then gives FDA statutory authorization for what it was doing anyway. And what has happened, what has evolved is this system where everybody takes for granted that the government should be deciding what consumers should need a prescription in order to purchase and what should be over the counter. But and the reason that people generally support the government having this power is they think, well, if the government requires prescriptions, that'll make patients safer, right? Turns out that's not the case at all. The government requires prescriptions makes patients less safe by requiring prescriptions for drugs that are safe for patients to use. And at the same time, there are all sorts of unintended effects of giving the government this power, such as increased consumption of riskier drugs that puts patients at risk, and really weird counterintuitive effects you wouldn't have imagined. Like for a decade or more, the FDA was requiring prescriptions for non-sedating antihistamines like Claritin, which are very safe drugs, but allowing people to purchase much more dangerous drugs, much more dangerous sedating antihistamines like Benadryl over the counter. So what effect did it have that the FDA was imposing barriers to safer drugs and allowing people to purchase more dangerous drugs, which, by the way, is the opposite of what the FDA was supposed to be doing? It pushed people toward buying these sedating antihistamines, using those, and that led to an increase in automobile accidents and fatalities, air travel accidents and fatalities. There's a literature about how those sedating antihistamines have done this, yet the FDA made us less safe by pushing us toward those drugs. And when you look at all this issue from a macro level, as an economist named Sam Peltzman did, what he found is that after the FDA began imposing these requirements, poisonings, whether accidental or suicidal, went up in this country by about 50 to 100%. And there's no difference between infectious disease mortality in countries that do impose prescription requirements for antibiotics versus those that don't. Moreover, he found that prescription requirements correlate with higher poisoning mortality in countries that impose them rather than lower mortality. So this is sort of the history and the effects of these government-imposed prescription requirements, and that's why in this paper we just argue for getting rid of the government's power to impose these prescription requirements entirely. And we could, and once you do that, manufacturers will still require prescriptions for unusually dangerous drugs.
What is the if you take away this requirement? What is the market's reaction to it? Do they just start flooding the market with dangerous drugs, or is there an actual rational development?
No, on day one, nothing will happen because drug manufacturers are very risk averse. They don't want to do anything that would expose them to greater liability. But what will happen over time is manufacturers of drugs like oral contraceptives will start offering them over the counter directly to women because these are drugs whose safety profile is such that consumers can handle them, can use them safely on their own without consulting a physician. They may, drug manufacturers may require women to complete a questionnaire, read some promotional materials, maybe even at a kiosk where they can then sign off that they read and understood those materials. That'll both educate consumers, protect the manufacturers from liability. But over time, what's going to happen is you're not going to have unnecessary prescription requirements denying women access to oral contraception or denying people access to life-saving drugs like naloxone, which is an antidote to opioid overdoses. These things should be available, next to fire extinguishers and defibrillators and in all sorts of public places to help reverse opioid overdoses. Naloxone is completely safe. The inhalers are so easy to use that a child could do it. And yet the FDA requires prescriptions for these drugs. They should be available not only over the counter, but in vending machines and for free if you break the glass. Take also insulin. Canada requires or allows U.S. consumers to go across the border and purchase any type of insulin without a prescription. Here in the United States, you need a prescription to purchase almost any type of insulin. These are the sorts of changes that we would see over time, and they are changes that would bring essential medicines within the reach of people and cause prices to fall. Not only would the non-price barriers disappear, but the prices for these medicines would also fall, which is another really interesting angle or area of this issue that we cover in our paper.
Yeah, people police themselves. Doctors are allowed to practice medicine, and companies, of course, have to protect themselves as well. I think it makes perfect sense in the free market, and it's why I think that this is an important paper, not just for this, but really for healthcare reform in general, because that access and price thing is a big deal. And what you're hitting at here is something that I believe is easy to change, is obvious to change, and therefore is possible to change. So I want to thank you for this paper. I want to thank you for coming on to our channel. And for everybody watching, please subscribe, slap that like button, and leave a comment about a paper you might want to see next time. Thank you.